Oh, that's no worries. Welcome, welcome. Thank you for joining us. And so we're just introducing someone who is going to become a provider with years of experience in the field and has worked with survivors of brain injury in hospital settings and medical settings, and particularly in rehabilitation settings. And so we are very blessed today to welcome Maureen Hall-Katz to talk to us about medical speech therapy and how that might be helpful for us as survivors of brain injury. Give her a round of applause. Woo! Oh, yes. And close that for you.
You are also in things that you're doing, projects, information that you're getting out. Incredible work. Congratulations. Well, yeah. A little bit about me first, and then we'll go to you guys. But so I am a speech language pathologist. Been doing it 38 years, 28 years at St. Jude, which were inpatient and outpatient. And now I've retired from St. Jude, and I'm developing my own private practice, so I can continue to do what gives me great passion and love of life. So,
excuse me, could you sit closer to the microphone? You're breaking up a bit. Yes. Thank you.
Is that better?
Yeah, definitely.
Okay. So all of you are people who have had experience of brain injury. Is that right? Or a stroke? Can you raise your hand so I can get an idea? Okay. So pretty much everyone. Thank you, guys. Any caregivers? No caregivers. Leo's a caregiver. Okay, fantastic. And Billy, William. Okay. All right. And how many of you are currently getting speech therapy? Okay, Nitz is getting speech therapy.
Leo and Kenny.
2 out of about 20 people here about?
Yes, 25.
25.
About.
Okay. And have you all gone through rehab, acute rehab, when you're in the hospital on the rehab units? Okay. All right. So someone's taking no.
31 in here.
31 in here. Someone's saying no. But a lot of people have. But a lot of people haven't. So, wow. That's pretty great that you're able to move on with life, get home, hopefully get back to jobs in your community. That's what it's all about. Okay, so as a speech therapist, all of you know that we work with communication, right? Getting people to talk again. We work with speech sound disorders, articulation disorders, weakness of speech muscles. We work with cognition, as your wonderful leader, Daniel, has put out, and you're doing a great job. My goodness, you rock. You really do, and so is this group. It's incredible. Post-concussive syndrome, as we were talking about, some of those sports and athlete issues. Swallowing disorders, we work very closely to get people swallowing and get them back on diets, and then voice disorders. So weakness from the injury or generalized weakness, respiratory muscles, we work hard on making that stronger for people so they can be clearer and speak with more confidence. Specifically, when thinking about the role of the speech therapist in brain injury, I feel like I'm talking to the choir here when I'm saying this, because all of you know that no recovery, no injury is the same as another, and recovery is influenced by lots of factors. Do you want me to ask questions? Like, do they for feedback?
Oh yeah.
What kind of factors would be related to recovery? Any ideas?
You can just ask it out there. So yeah, generally, like when it comes to getting better, right? Getting better, recovery. What are some things that might be helpful in getting better?
Or influence getting better.
Influence getting better.
To be believed.
Be believed.
Validation, right?
Yep.
Funny.
Music therapy and sound baths have been very helpful, or any kind of music, art, foreign languages.
That's fantastic. Yeah, that's great. So
anything that facilitates like neuroplasticity and your brain being able to reorganize tasks to the healthy areas of the brain. So activities that facilitate that process, like yoga, exercise, healthy eating, getting good sleep.
I'm doing visual therapy and neurobiofeedback too, and they're helping.
That's excellent. So good. The resources are out there and you're accessing them. That is what it's all about. And so when somebody asks you or says to you, or you've asked others, how long will it take me to get back to normal? What's the answer you give them on that?
There's no straight answer for any one person because all of our TBIs look different and all of our situations are different. It's really on a case-by-case basis. Like, I mean, each of our stories is incredible, really. And just, I mean, the fact that we're all here is testimony to the fact that, like, brain injury, it's not gonna get you down. Like, you can reinvent your life and do something different and still be purposeful and meaningful and being able to contribute back to the world. I think that's the most important thing is, like, maybe we lost the capacity of our prior lives before the TBI, but like we're now able to contribute in different ways that, you know, maybe some higher power God intends in a way that we didn't expect, but it's just a new life. It's being reborn into figuring out a new way of doing things, of living life, of being in some ways.
Yeah. So there's no magic number, right? You know, to getting back to meeting your goals, but there's no magic number to say that a person's not going to make progress any longer, right? So recovery, no ending.
Yeah. So all the past medicine that states that like nobody could ever recover from brain injury is a lie, because clearly we have, and we've all reinvented our lives in different ways, and we are rewriting history, you know, as we speak. You know, there is no formula for how someone is supposed to recover from TBI. It's different for every person. And because we all have different areas of the brain that are affected, it all looks different. There is no one size fits all answer.
And we're not getting back to normal. We're getting back to optimizing the best to our potential.
Yes, exactly, Jason. We are optimizing the best of who we are, of what we got. That's where we're at.
Yes.
Yeah, there is no normal. Well, for me, I know after today's 21 years, I'll never be back to who I was, but I never expected to be who I was. Like, that person died when I almost died, you know, so not that I don't think I could be that person, but I think I'm a totally different person than that person. And then, like you were saying, like neuroplasticity, everyone uses that every day, brain injury or not. So that's how we keep going and learning new ways, just like everybody else.
Perfect. Yeah. So, like as you've all been saying, so Pecos to Bobby, what we're talking about right now is the factors that we believe are helpful to getting to recovery, right? Things that we have done, right? So people have shared things like, you know, music therapy, neurologic music therapy, which we had last year, right? We're planning again soon, or other people have talked about, right? Yeah, see there, you right there, Nitz. Right, and so, and what was that, Leo?
Having a routine.
Having routine, structure, right?
Main thing for me. That's how I started it all. Building a routine, keeping the routine gives you purpose to do
Getting
something.
up early, drinking lots of
creates
water,
purpose.
working out.
Purpose, right? And exactly right. So, online with purpose is at what point does recovery happen? At what rate? And so when people ask you, so how long before you get better, right? And as we all kind of smiling and laughing, is like, that's kind of a silly question, right? At what point do you stop needing your brain, right? So I guess that would be the kind of ask you a question, right? So you've all said great things here. So Medell said recovery is relative, right? And then for Lisa, she said faith. I mean, so huge is faith. Being able to find, like what Leo's saying, something that is purposeful and meaningful in the future. gives you motivation in the present, right? And so important there. And so, and Swanee just put in the chat, if you're into music, using music as therapy. So Swanee has teaching there. And so, right, what a huge progress for Swanee as well, right?
Yeah, I sorry to interrupt. I can announce that at the end if you'd like.
Yeah.
So sorry. I just thought I'd post that for everyone to see.
No worries. Yeah, we'll announce it at the end. And so, yeah, you were saying?
I think that, when you talk about spontaneous recovery, right? It's when I went to graduate school 38 years ago, they told us that within 6 months to a year is you maximize all recovery.
Is there any way to put the speaker closer to the mic or the mic closer to the speaker? Because we could barely hear her. Daniel?
I second that.
Yeah. So, can you speak? Yeah.
Actually, just real quick. Sorry. So I think that what's going on, Daniel, is that you shifted the microphone away from the speaker, because we can hear you very clearly when you're in front of the laptop. We cannot hear the doctor when she's speaking into the speaker. So I think the mic is coming out of the laptop specifically now.
Yeah, I think that's correct.
Try now. Try now.
Okay.
No,
Nope, still no.
we can hear you fine, Daniel, as Ruben said, but we can't hear the doctor too well.
Yeah.
Yeah, so I don't know where the microphone
How's it
is.
now?
Daniel, you want to get the microphone closer to the doctor?
No.
Okay, there we go. A little bit better.
Any
Yeah.
better?
Little bit
I'm
better.
sorry, you guys, that this technological difficulty is interfering with our communication.
That's
You want me to
better. It's
your
better.
laptop?
Coming through.
Susie
Yeah,
said
it's
she
coming
could
through
hear me.
better. If you could
Okay,
increase
all right,
the
so
volume, maybe.
I'll just continue, and then
Yeah.
so I'll field any questions that you have specifically, but we're talking about in 3 to 6 months, what the speech therapist would be doing is assisting, like you said, maximizing your potential recovery, particularly for skills that were lost, working hard with the OT and the PT with you in that first 6 months, talking about neuroplasticity. I don't think we have to talk anymore about it, because this is so where you guys are at, and you totally get that, right? But speech therapy during this period is very focused on practicing and training the brain to improve attention, reasoning, right? Problem solving and memory. Necessary skills that you've got to have to be able to, live on your own, live in the community, carry on with the job. And the third mechanism of recovery is adaptability. And I really loved what I've been hearing from all of you, because adaptability is the ability to meaningfully change our behaviors, right? In order to adapt to what's going on in our brain and to adapt to what's going on in our environment. So the role of the speech therapist during this period is to develop and help the patients target self-awareness of your own cognitive processes, right? Does anyone know another word that floats around for that ability? It's called metacognition. Have you heard of it before? Susie has.
I've heard of that term, but I never knew what it meant. So thank you for explaining it. It's it's the opposite of anosognosia, which I know that means, Daniel taught us, it means when you don't know what you're doing.
Yes, right. So very common in a brain injury to lose that ability, and such an important thing to have. So the ability to think about thinking about thinking is metacognition. So during this, we try to help our clients understand strengths and weaknesses, right? What are your strengths? What are your weaknesses, right? You talked about developing effective individual routines that work for you. And they're all going to be different. What works for Kurt isn't going to work for Daniel, isn't going to work for Rosalie. They're all different. But what's important at this time for you, and you're all in the environment, you're all at home, it looks like. Do you all have jobs too? Are you working too? No one's working right now. Okay, still. Okay.
I'm working.
Who's that? Suzanne?
Swanee. Yeah, Swanee.
Okay. Yeah. Okay. Fantastic. do you, and has therapy ever worked on?
And Pecos is working.
And Pecos is fantastic. So developing goals, right? What are some things you guys want to get accomplished, right? Develop a goal and a plan. What's the plan to reach the goal? Then helping you do the goal or do the activity, and then reviewing it. So when you review it, do you think to yourself, how did I do, right? Did I complete my task? What could I have done differently? Those are really important parts of metacognition when you're thinking about recovering and getting things done. I'll talk a little bit about group versus individual speech therapy. I am so wowed at what you've accomplished in here today and talking about all the things you're putting together. I want to be in this group. Can I be in this group? I really would like to be in this group.
Go on in.
It's phenomenal. So you know the power of interacting together, and the social connectivity that you're doing this very minute is so key to happiness and longevity. We know that in just normal aging population, that those who have stronger social connections have longer lives and more fulfilling lives. So you guys are doing the right things by attending this group and really being committed. Individual speech therapy is a bit different in that it's very focused on what your goals are. So what your goals are, what we're working on, your personal goals, what you'd like to do better. For some, it may be just speaking clearly, speaking louder, speaking better. For others, it might be improving job-related skills like organization and higher reasoning and problem solving. I love that you were talking about apps, because if you, and you guys are all pretty young, so I'm sure you have smartphones, right? No? Michelle doesn't have smartphones.
Yes, some of us have smartphones.
Okay. So talking about those apps, right? Those reminder apps on your smartphones, calendar apps, memo apps. A speech therapist would set those all up for you, get those on your phone, or make those work for you. But for those of you who are not into those phones, the physical calendar, right? The journal, the organizer might do that trick, right? And others might just want to have much more meaningful conversations with their loved ones and friends and need practice or strategies on how to do that better. Communication and the ability to relate to one another is essential for a happy life, and I know you all know this, and conversations are very important. So what I didn't realize is that so many of you would be online, but I'm going to have Daniel put this, it's called the Communication Participation Bank form, and it's just a quick 10 question form that you would answer on what areas of communication you feel comfortable with, what you'd like to do better. It gives you a good insight into what you need at any given time in terms of communicating with others. So if your responses suggest that you could make some improvements, seek additional help. I know Linda here has been going to our communication recovery group at the outpatient center and has been involved in groups. And if you feel like individual therapy might give you just an edge on an area that you need more specific help with, give us a call. I'm going to leave my card and my flyer, and I can be reached by phone. I can be reached by email if you have any questions. And I'd love the opportunity to work with you. So with that, do you guys have specific questions about what speech therapy does or what it doesn't do or your needs?
Yeah. Oh, and Michelle, you have a question there. And of course, all these materials, I'm going to get them all to all of you through the newsletter and email. So I will get all that contact information out to you. Michelle, you had a question there?
It really wasn't a question. It was an observation. I've gone through a really brutally difficult recovery of my sister from cancer and a stroke. The cancer caused the stroke. And one of the things the speech therapist told me, which just blew my mind, was that they always started with speech therapy because that was the most important thing to get the brain going.
Yeah, it is very important.
I never occurred to me that would be it. I would have always thought it was physical therapy. She said, no, that's important, but speech therapy more than anything fixes the brain.
Yeah, communication is our heart, is our soul, and it's what we need to do and have in our lives. So that's why it's so important to focus on it. Not putting physical therapists or occupational therapists down. They all
no, they're all valid. Yeah, she worked with all of them, and they all. Yeah. It was just, I never thought speech therapy, I never understood how speech therapy could be that important. So it's fascinating.
Yeah. Oh, I'm so glad. I saw somebody had a question about swallowing from a whiplash injury. Any lack of use or misuse or underuse of the swallow muscles will affect your swallowing. So I'm wondering if because you were, you had the whiplash injury, you were being very cautious and you weren't doing a lot of movement, lateral movement or up and down movement, and that's affected the strength of the swallow response. Could that be true?
Oh.
Whoever asked the swallowing question.
I'm not really too sure. I've had
There
a
you
lot
go.
of
Lauren.
yeah. I've
Okay.
had a lot of issues with that since the accident, like volume control. I choke on like water and food a lot. They told me like cervical dystonia. So on one side it was pushing my face and like my neck to the right.
Right.
Yeah. So I just wasn't sure. I never got any kind of therapy. So I don't know if that would.
Is it still a problem? You're choking on water still?
Yeah.
Oh no, you definitely need to come in and get some swallowing therapy so we can strengthen those muscles so the function of the swallow is stronger and the protection of your vocal cords you've got to have protection of your vocal cords. When you swallow, the vocal cords close so that nothing can get through to the lungs. So strengthening the vocal cords is very important too to protect your airway. So yeah, I'd really encourage you to get some swallow therapy.
Wonderful. And you said that your contact information will be sent later?
Yes, my cards and I work in Fullerton. I'm in an office on the corner of Harbor and Brea Boulevard. And so how many of you are local?
They're from all over the place.
Oh, they're from all over the place. Yeah. How cool.
Yeah, some of us are in Orange County, some of us are in different states, some are in Northern California. Daniel's really grown this because he's amazing.
I'm in Sacramento. Yeah, we have individuals that are coming in from Canada and from Mexico, but Americans from Mexico and then all over the place.
Yeah, it's because Daniel's amazing. I found Daniel through Instagram in 2017. And then that's how I got to hit one of his groups and then came here.
Oh, you guys are so fortunate. This is just very impressive, really impressive. But
they're all very impressive.
Yeah, if you though you would contact your physician. For example, who had the swallowing problem? You'd contact your physician and get a prescription for a swallow eval and treatment. And I really think it would help you. Definitely.
If I could, sorry to interrupt, but if I could please add something here to what Lauren was saying. Lauren, I remember you mentioning before that you had an issue where you couldn't relax your abdomen. Was that right?
I'm not sure if that was me, but no, I've just been having issues with like even when I'm not drinking anything, like I kind of choke on it's gross. I choke on my own spit sometimes.
Yeah, that's very common. That's very common.
Yep, I did that.
Also have trouble like with volume control, and sometimes everyone's like talk louder and I just physically can't, or sometimes I'm screaming and I don't even realize it. So
yeah, I remember that.
Diaphragm. Yeah, right. And knowing how to use that air, that capacity to project your voice is something you have to learn. Yeah, something you have to be taught after an injury.
Can I give a little, as a singer, one little brief thing people can do to increase volume?
Yes.
It's really silly, but it's amazing. You squeeze your stomach in, and then you squeeze your butt like you're holding a penny between your butt cheeks. And that, I know, is you never forget that one, do you? But it is unbelievable the amount of control you get in your volume, and to the point where I have to be told to shut up because I'm too loud. But it increases your volume,
so I can teach others.
It's just amazing.
That's an interesting visual.
All right, we're bringing pennies next week.
The tagline of the show.
Say it
What's
again.
that?
And trying to make a six pack with your stomach.
Yeah, there you go. There you go. You got it, Daniel.
And you don't have to have a six pack, but you like flex your abdominal muscles. You're not flexing your diaphragm, which is what Michelle's tip does. It's like what they do in Kegel exercises.
Daniel, do you have a tracheostomy?
Yes, I do.
Oh,
This is a cat much.
yeah. And it's capped. Wow. How long have you had your tracheostomy?
In 2019.
2019. Wow. Are you working on getting stronger and swallowing and talking so you can get it out?
I can't swallow. Like I can't do the esophageal tumor. I had to get surgery to like basically I drink I'll be blunt. I drink industrial strength Drano because the bottles say caution, fatal if swallowed. Well, I see them for lost advertising.
Is someone helping you, Daniel? Is a speech therapist working with you?
Yes, I'm working with a pathologist right now. I see him keeping the appointment.
Okay, good. Well, I'm glad you're going to be
You
seeing
can pass the year valve on this, but this Friday, on Friday and Saturday, I work a cap.
Yeah, and you just capped it, which is a little easier, don't you think, than using the passing valve?
Passing mirror is not bad. I'll wear it for 24 hours plus at a time. When they first gave it to me, they wanted to see how I did with it. I was like 3 hours, 6 hours, and so on and so forth.
Right.
All I did was add extra oxygen to my body.
Good.
Knowing that people get tired easier.
Does anyone have any other questions about
Who's
swab?
talking?
Use your diaphragm. Ruben's got a question.
Yeah, Ruben, you have some there, sir? Or it's hand up from last.
Can I quickly add one thing about the diaphragm? If you can
Yeah,
get
I was
down
just
on
going
your,
to say that mine was up from before.
if you can lie down on your back, it's the best way to get in contact with your diaphragm.
Mm-hmm. That's
And
right.
then if you can't lie down on your back, if you bend over at the waist or the hips, that you can get into contact with your diaphragm. Strengthening your diaphragm is the best thing you can do.
Yeah, when you talk with your diaphragm, you say, I got louder. I'm not yelling, saying this and not be out of breath. If I was yelling, it'd be like this.
Yeah.
But if I protect and to talk with my diaphragm, my volume increases exponentially.
How many pennies are you holding? Okay. And so, Heather, yeah, and yeah, there's a question from Kurt, and we'll go to Heather real quick. So now that we have Maureen's info, what do we do with that?
Well, if you need, and you know, I'm not doing Zoom therapy, I'm actually seeing patients. So if you'd like to be seen, you get a prescription from your physician, you can have it faxed to me or emailed to me, and we can set up an appointment and start working together.
Right. And so,
what is your fax number?
It's on the
I have
card.
the information in the chat.
yeah, I'll put it in the chat again. And so, essentially, Maureen, could you, if people were to contact
Yes.
you, if they were to contact you, I put it in the chat.
Okay.
And so, if people were to contact you, could they get assistance with navigating?
Most definitely, I can help you through getting a prescription. I can call your physician. I can have them fax it to me or send it to me. Either way, but if you need the help to do that, I can definitely help you out.
Perfect. So I mean, that way, you know, there's some additional assistance.
Oh yeah.
You need the prescription to see the speech therapist, but if you are unsure of how to navigate that process, how to do that, or where to go, Maureen Hall-Katz, you give her a contact, she'll be able to assist you through that process. Yeah.
Yeah, definitely.
Perfect. Heather, you have something there?
Yeah, I had two questions. First question is, are you a specific neuro speech?
Yes. Most of my practice has been neuro, in that I've worked at inpatient in the hospital, outpatient. So see adult neurogenic patient disorders, Parkinson's, ALS, brain injury, stroke, the gamut of neurogenetic diagnosis. Yeah.
We should probably look, maybe instead of just getting a regular speech, look more for a neuro speech might be more helpful.
Yes, I very much agree. Somebody who can treat these different disorders, specific for adults as well, not someone who necessarily does pediatrics, but adults is important, right?
Absolutely. And such a great point there, Heather, is like, if you connected to speech therapy before, do they have specialty in neuro?
Right.
Because if it's just a speech therapist who doesn't necessarily have that familiarity,
right,
that may be explanations as to why you maybe didn't have as full an experience as you could have. Right?
Yes, I think that's a great way of describing it. Yeah.
My second question is, it's been 21 years, so I don't know if it's still an issue, or I don't know if it's my acid reflux GERD that I have, but when the doctor went in for my aneurysm, he said it burst like when he was in there. So he said he didn't leave any nerves hanging, but he bruised some. And that's why I couldn't talk. Like I had a very low voice. And still to this day, I can't like yell, like scream. When like girls get scared and they scream or do stuff like that, my voice won't do that, and it won't like sing like it used to sing. And I don't know, again, if that's because of my acid or because of that, because I've had my acid since then too.
Heather, when's the last time you saw an ear, nose, and throat doctor, an ENT?
Oh gosh, that's been probably since high school when I was diagnosed with my GERD, because I thought that was a sore throat from that.
And GERD can affect the muscles of the throat and the pharynx and affect the swallow. But I'd love for you to have an ENT take a look at your vocal cords and make sure that they're functioning well and that they're protecting your airway. Yeah, that's really important to do before a speech therapist can work with your voice. We need to have you seen by an ENT.
Okay, because just like Lauren was saying, I choke a lot, and but I also get food stuck a lot. But I think that's my GERD.
Yeah. Are you taking medication for your GERD? That's really,
I am. Yeah.
Okay. Keep on that. Don't stop doing that. And then, really look at your diet and not eating too late at night, acid, drinking wine late at night. All those things definitely affect your GERD.
Yeah, definitely.
Yeah.
Okay. Yeah. Thank you. I just didn't know my throat often hurts too, like at the end of the day.
Yeah.
And my voice gets sore and like comes like a sore voice.
Yes. A weaker voice. Yeah.
Yeah. And I'm like, is that again acid or that? But again,
it's a combination of factors for sure. But have you ever had electrical stimulation therapy done? E-stim, it's called E-stim, where you get electrical stimulation to the muscles of your throat.
No, I've had it like in my back because my neck is very weak. I think because when they cut into it.
No, E-S-T-I-M, E-stim, electrical stimulation. Yeah, sorry, I'm talking to Daniel. Yeah, so that would be another modality of swallow therapy that could be very effective for those muscles of your throat and your vocal cords. So speech therapist who does E-stim could be very helpful to you.
Okay, great. Thank you so much.
So welcome, Heather.
God, I have one more question. Do you guys care?
Do you guys care?
So everyone keeps telling me a speech therapist could, or not everyone, someone said that a speech therapist could tell me because I have a problem with getting things from my head to a written form or a typed form. It just all of a sudden will block.
Yeah.
Like I can talk to you guys for like an hour,
Right.
as you can see, but if you're like, write this person an email,
Yeah.
or write your story down, or write this, it will
Yeah.
be blocked.
Really hard.
And,
Yeah.
and so much even that even if I sometimes go to like record it thinking that will help,
Uh-huh.
it like becomes a block. Doesn't want to
Yeah.
come out. Is
Yeah.
that something
right.
that's fixable? Is that a problem, or
Something
is
that
it just me?
Well, is it a problem for you because that really inhibits your ability to do emails, right, or communicate by writing? So yeah, if it's a problem, you should be working on it. Yeah, it could get easier, right? With focused practice. There's something called Touch Type Read and Spell. It's a program, an app you can put on your computer, and it's kind of like typing practice, but you can see it and you can hear it, and that might really help you too. Touch Type Read and Spell.
Read and spell. Okay. Thank you. But
Well,
that is, would you say, associated with my brain injury?
For sure associated. It's called dysgraphia, and many people have difficulty with it. But even after 22 years, you should be working on it little by little. Yeah, it'll get better.
Okay, thank you so much. Again, it's one of those things that I wasn't sure if it was something I made up or it's actually a brain injury thing.
I don't think you made it yeah.
And,
All right, thank you, and thanks guys for letting me ask so many questions.
Absolutely, like this is the platform.
Yeah,
Doing so,
right.
So, great point there, Kenny. You said some people who don't have a TBI, and you're exactly correct, right? Some people don't have that traumatic brain injury where there was a physical force, right, that caused mechanical forces. And so that's the thing. So a TBI, a traumatic brain injury, is specifically due to some sort of mechanical force. And so it's very arguable that any brain injury is traumatic, but specifically what we are referring to is mechanical force. But just because you did not get your brain injury from a traumatic force, a mechanical force, does not preclude you from participating in and benefiting from speech therapy. Whether you get your brain injury from a vascular accident, anoxia, or hypoxia, or an infection like a encephalitis or meningitis, a tuber resection, or TBI, you can all benefit from cognitive training and speech therapy. Michelle, you had a question there?
No, it's just a follow-up for Heather. As you well know, I got my brain injury in the dark ages, and there was no help for me. So I would literally stand in front of a mirror and talk to myself out loud. And, if anybody came in the room, they would start backing away slowly. But that's one of the ways the only way I could figure out. Because I remember sitting down trying to write and nothing would happen. And there would be this massive mess going on in my brain. I know exactly what you're talking about. You are not alone. So, and I love how you asked the question. You asked it for so many of us. So thank you for that, Heather.
Thank you, Michelle. I, for like 16 years, also didn't get any kind of therapy. So by that time, I had made up my own strategies, but never for that. I just couldn't figure it out. I was like, I just can't get over this block. But yes, that's why I always tell everybody I love playing Taboo now because I'm good at it. Because for years I had to think of different ways to describe things so I didn't shine out that I had no idea what this word was, things like that. But yeah.
That's a great way to frame it, right? Frame your difficulty.
Right.
framing them.
Yep.
And so same with Michelle. I think you were in the dark for about 5 decades before you were able to get help for your brain injury, correct? Right.
Wow.
So
And even though that's sad, because I sometimes feel sad about like only 20 years, like I also like see the difference that there is now, and it makes me so happy. And like just in that amount of years, like what is there for people now? So that, Michelle, you must be like, whoa, holy, what a difference.
yeah, absolutely. And so as we were talking about, I think it was last week or the week before that, is similar to ADHD was in the 90s, where
Yes.
it was almost like a punitive thing to have that. Now, versus if you would have ADHD in the 2020s, you would now get resources, you would now get support, right? There's resource centers for that. Right? And so similarly, we're all of you are playing huge parts in creating not only a future for our community, but for a future for the future survivors 5, 10, 15, 20 years down the line. And so
Awareness and education goes a long way.
The truth.
absolutely. And so any other questions for our esteemed guests?
Where's your office located at?
My office is located in Fullerton, 1440 Harbor Boulevard.
Okay,
Yes.
thank
Yeah.
you.
Rachel, you're in Sacramento, yeah?
Yeah.
Okay.
But Sacramento State has a fantastic graduate program, and they probably have a clinic, Rachel, that you could get to, and they could work with you there. Sacramento State.
Okay, thank you for that information.
Yes, and the person to speak to, her name would be Darla, Darla, and she's one of the PhDs there, and she could help you out, get you into speech therapy at Sacramento State.
You know how I reach him?
I think Daniel's trying to get that information. It's Darla Hagee, Hagge. That's okay. Darla, Hagge.
Can you say it again?
Darla,
Thank you very much.
Hagge, 2 G's, E, at Cal State Fullerton. I mean, Cal State Sacramento. Yeah. There she is.
Okay,
Yeah.
right here. We got you. We got you there. So
Is it in the chat?
yes, I am going to put that in. So we got you here. So so here in Perla and Kurt, Kurt, were you 6 hours? So are you Northern California, Kurt?
I think they're off there.
Oh yeah. Thank you, Miss Katie. Oh yeah. So Kurt is from San Jose, right? So and you had an anoxic brain injury, and then so Miss Katie just put it in there. So Rachel, Darla Hagge's information is in the chat. So great, perfect question. Other questions for our esteemed guest? Well then, please join me. Oh, you have something there, Heather? Yeah. Oh, Heather.
I just asked in the chat, do you know anybody in Santa Barbara?
Ooh, I can research that for you and get back to you. I could definitely do some research on that.
Because I've gone to speech before, but I don't think they were specifically neuro. They were at cottage rehab.
Oh, right.
Which is very...
Yeah, they have a rehab program there, but I will seek out private people for you, and specifically for voice and swallowing, neurogenic voice and swallowing. Okay.
Thank you.
Get me on that so I can join up.
Yeah.
Thank you for all your help.
Oh, you're so welcome. Thank you for all your amazing stories and all your progress. Very impressive group.
Oh yeah, you're all very we're all very impressive, right? Thank you very much. Join me. Give a warm rainy to Kitty that's on there. Oh, last minute. Okay. Last minute question. Yes, Kitty. Kitty, you had something?
Yeah, I'm not sure, but I think Kurt was asking about San Jose. Kurt, were you asking if they had somebody in San Jose?
Oh yeah. Well, then I'll put it out and then we'll circulate to everything. So please join me. Give a great thank you to Maureen Hall.
Thank you so much. Yeah.
Thank you guys. Thank you. Nice meeting you.
Thank you. Thank you.
I'm doing sound effects in the video.
Gotta get me connected to this game.
Absolutely.